Hello, everyone, and welcome to this online Bronson presentation sponsored by the Portage Senior Center. I am Julie Vandernoot, the Program and Volunteer Coordinator for Portage Senior Center. Today, we will be learning about in-home care due to illness, injury, or recovery. There will be a time for questions and answers at the end of the program. Please utilize the chat box so I can present questions at the appropriate time. It is my pleasure to introduce Hilary Knight. Hilary is the System Director for Bronson at Home. Hilary is a registered nurse and has been with Bronson, for nearly 20 years. She has held roles in a variety of areas, including nursing, quality and safety, accreditation, and home health. Her experiences across the Bronson system have allowed her to be a part of the continuum of care for our community members. Hilary, please take it away. Oops. Hilary, if you can unmute on your end.
Okay, there we go.
There we go. Sorry for the glitch, everybody.
So good morning, and thank you for letting me come and participate in this meeting. And unfortunately, we're doing this, over the computers rather than meeting together in person. What a difference a year makes in our lives here. So fortunately, we do have this technology available to us, and I'm pleased that we can get together and that I can share some information and then hopefully answer any questions that you might have. So based on what was kind of advertised to the world, I set our goals for today to help us understand the differences among the types of in-home care that's available in our community, and then also understand some of the payer requirements for the different types of in-home care. So what is home care? That's a good question, and I don't know if anybody has gone out and used the magic Google machine and typed in home care, but when you do, you get quite a variety of things popping up. And so there's a lot of different names, similar names, and so it can be very confusing as to what exactly it is that you are looking at and whether or not it's really what you're searching for. So you'll hear of home care, home health care, non-medical home care, Medicare certified home care, home personal care, private duty care, and so on. And so I hope today that we can kind of clear up some of the confusion there and that you'll have a better idea of what each of these represent. So what I did was kind of bucket the types of home care services and some of the names that you may see so that you would have a better understanding, and we'll go into each of these a little more in depth, but we'll kind of do an overview right now. So if you see home health care, then that generally is referring to the type of care that you would get from a physician-directed order, and it would help you recover from an illness, injury, or hospital stay. And it's also known as Medicare certified home health care, medical home health, or visiting nurses services. You'll see different names like that. I'm not sure about this annotation. I'm going to, not sure what that is, but I'll close that screen there. Sorry about that. When we talk about private duty nursing care, so this is nursing care that's kind of designed for long-term need in the home, often with patients who have very severe illness or injury, and they need a much more extended period of time of having nursing care in the home. And then personal care is the type of care that you would get from a home health aide, someone who would come in, help with activities like bathing and dressing, maybe meal prep, might be doing some laundry services. And you'll see that some of the names that are used when you're looking for that care: non-medical care, home health aide care, senior care, homemaker care, companion care. So that is kind of the non-medical side, where the home health care is directed more towards medical needs. Okay, and my screen is frozen. There we go. Okay, sorry about that. Technology. The other types of home care services that are available are hospice and palliative care, and I can talk briefly on those pieces. And then also home medical equipment, which is also known as durable medical equipment, and home care supplies, and we can talk a little bit about that as well. So I'm going to start with what is home health care, and so I think having the word health in there will help clear up some of the confusion. So again, this is short-term care that's been directed by a physician to help a patient recover from an illness, injury, or hospital stay. The wonderful thing about home health care is it's a great transition from being in an acute setting like a hospital, or following a nursing home stay if that's required. It's a nice transition home where you've got medical staff there to kind of guide you through that transition to being at home again on your own. So home health care is usually less expensive, more convenient, and can be just as effective as the care you would get in the hospital or in a skilled nursing facility. Examples of the skilled home health services are listed, a few of them here. So wound care, chronic disease management, certainly orthopedic and joint replacement care, following surgery, being able to follow up on incision care and monitoring for signs and symptoms of complications. Rehabilitation services like physical therapy, occupational therapy, and speech therapy are available and are used quite a bit for folks, again, who have had orthopedic care provided to them, or who are debilitated from having had an extended stay in hospital or skilled nursing facility. Most home care agencies do quite a bit on fall prevention in the home, and then also provide caregiver education and continuous monitoring of illness and health status. So how is home health care provided? So first off, it needs to be prescribed by a doctor. So if you're interested in having home care for yourself or for a family member, it's something that you need to work with your primary care provider or physician from the hospital stay that you had. The care is provided through visits from specialized clinicians. Again, most home health agencies have nurses, physical therapists, occupational therapists, speech therapists. Some of them have nutritionists, medical social workers. So again, it's very specialized care, and it can be really tailored to what your need is. You don't need the entire team if that's not what the program is required for your particular care. The visits typically last about an hour. Sometimes they might be a little longer, and they occur a couple of times a week. So again, this is a very intermittent care model here, where you've got, yes, wonderful specialized clinicians coming in, but they're only there for a few hours a week. And it's really designed to be used on a short-term basis, generally 30 to 60 days, or until patient goals are met. And how is home health care paid for? When specific qualifications are met, generally having to demonstrate that the care is really required to be provided in the home and not in another setting, then home health care is typically paid for by Medicare and private insurance. Medicare is probably the most stringent in its requirements for payment for home care, and the private insurance companies tend to follow what the Medicare guidelines are. That being said, it can vary from payer to payer on what they will allow. When we talk about personal care, so this is the non-medical care that would be provided in a home, and generally, like I said, is provided by a home health aide or someone trained to provide services in the home and to help with everyday activities like bathing and dressing, meal prep, and other household tasks that enable seniors to live more independently and safely in their homes. Again, the services are listed there, a lot of grooming, bathing, dressing, certainly some ability to help with mobility from bed to chair, and then certainly with meal prep, housekeeping, laundry, errands. The type of care that can be provided really varies from the different community partners who offer these services. But they're usually pretty expansive, the number of services they offered. They will run errands for folks or may help a senior citizen to the store and help them with their shopping, in addition to providing companionship and supervision within the home. Personal care is provided just by need of the family member in question. And so if it does not need a doctor to prescribe that care, it's provided generally in a couple-hour increments, but that can be over many shifts across the day. So if maybe having somebody come in for 8 hours during the daytime while a spouse is at work, and then they can provide the care for the person at home. Or it might just be a couple hours a week just to, again, give someone a break in the home so that there's still supervision for the person in need. It can also, frankly, be quite robust, and you could have somebody in there 24 hours a day, 7 days a week if necessary. I think the caveat to that is when you look at how is personal care paid for, it's generally paid through private pay. So usually the person who's receiving the services is responsible for paying for those services. There are some insurance companies that have long-term care that will pay for certain pieces of it or a certain amount of it. And Medicaid has some qualifications for individuals, and they will reimburse for some of that personal care. When we talk about private duty nursing, this is that long-term nursing care in the home. So rather than being there just for a couple hours a week, folks would ask to have nursing care available for extended hours every day. You'll also know that it's called home-based skilled nursing, long-term nursing care. Catastrophic care might be a term you hear. And you'll see that tracheostomy care and ventilator care, this is not uncommon for this kind of request for that private duty nursing. Again, this is something that probably needs to be prescribed by a doctor. You may be able to just go, if you are willing to pay, go and hire someone to come in and provide that level of care. But generally, because of the type of patient that we would be caring for, we would want a physician involved because, again, these are for very complex conditions and diseases, and would require, close monitoring with a physician, and the care that would be provided would be directed by a physician in terms of, the types of medications or the type of treatment that's being given. So while it may not be required for payment, it's certainly going to be prescribed by a doctor because of the close relationship in the delivery of that treatment. And again, private pay is probably the most frequent way that this is paid for. There are some health insurance companies that will pay for it and may do so in a shorter period of time rather than longer period of time. There's workman's comp that may cover some of the cost, again, because of the nature of the illness, and again, Medicaid with qualifications. So for instance, I know from personal experience with Medicaid that there's a fragile population of children that are eligible for this private duty nursing care because they have ventilators and tracheostomies. So that's the one that I'm most familiar with in terms of Medicaid. And then when we talk about palliative care and hospice care, I just want to kind of provide some background on what those are and kind of what the differences are. So palliative care is the specialized medical care for those living with a severe illness, and it focuses on relieving symptoms and improving quality of life. Palliative care is generally provided by specialized teams. These are not primary care providers, although they work very closely with the primary care providers, but it's generally a team of physicians and nurses who are experts in the palliative care. Again, these teams communicate closely with the rest of a person's medical team, with their primary care provider, and certainly with family members. And I think one of the key distinctions, palliative care does not signify the end of treatment. I think when we talk about hospice, people see that as being kind of the end of life, and that we're stopping aggressive interventions to prevent death. In terms of palliative care, the treatment can go hand in hand with palliative care. So someone who's seeking medical treatment for a significant illness, but is also experiencing maybe frequent hospitalizations or issues with pain control, they may benefit tremendously from having the palliative care team involved, because they would help them kind of manage the care in the home working with their primary care provider, but then also trying to reduce the need to frequent a hospital multiple times. And then when we talk about hospice care, of course, we're talking about the type of healthcare that focuses on end-of-life illnesses. And again, if a disease has no cure, hospice care can become the care option. The focus is not on curing the illness, but instead really trying to treat the symptoms that are present at the time and to help improve the quality of life that is remaining. I think one of the myths that's out there is that, it means that death is imminent, and it certainly does not. Having hospice care involved can allow someone to receive services that keeps the quality of life strong, whether it's 6 months or a year or beyond. And certainly if it's a fewer amount of time that's left, then the care is, of course, very important. But I wouldn't want anyone not to accept hospice care because they're concerned that that's somehow a judgment on how much time they may have remaining. And the hospice teams that we have in the community are really fantastic, and certainly worth having a conversation with what services are available and what they can do to kind of help that transition. Again, I think the difference to point out is the difference between palliative care and hospice care is that hospice care, traditionally, the focus is on making folks comfortable, and then we're moving away from aggressive treatments that would be trying to cure an illness. And then there's other services that are available in the community and may not be thought of much, and so I'm just going to kind of put them out there so that they're something for you to think about as you're going through the different things that are available to help keep people safe at home. One of the things that's out there are medical alert systems that allow people at a touch of a button to receive assistance at home 24/7. I always call it the I've fallen and I can't get up button. I don't know if you remember those commercials, but they've come a long way because there's, with of course all the cell phone technology and everything and computer technology, we have great capabilities now. So these small devices can be, worn around the neck kind of as necklace type style. And if you go out for a walk in your neighborhood and you fall, you can push it and be directed to either a family member or to a ambulance service. So some really nice options there for folks who are living alone, but would like to be able to summon help quickly if something were to happen. And of course, home medical equipment. There's lots of equipment that is available to seniors in the home. Some of it requires physician orders in order to have insurance pay for it. And certainly other pieces you can purchase yourself if you're interested in having them. The things that typically require a physician order, of course, would be wheelchairs, hospital beds, things like canes, crutches, walkers, of course, oxygen and nebulizers, because that's a type of treatment. But if you were interested in grab bars for your bathroom or some other equipment, a home medical equipment company would be a good option. And every insurance company is a little different in terms of what they pay for or how much they'll pay for. So very much you want to check in with your insurance company to see what is covered and what is not. I'm going to speak very briefly on a couple of programs, and by no means am I an expert on them, so I just I'm putting them out there for you, and if you're interested, we can certainly get more information, or you can look them up yourself out on the internet. So the state of Michigan, the state of Michigan has multiple area agencies on aging, and so these are great programs that provide information and services for older adults and for those who care for them. And we have local agency that you can contact, and you can find out about available services. They have mobility assistance program. They help gain access to other services. There's respite care that's available, and I believe that they also are able to provide some supplemental services like the having a homemaker in the home for a period of time. And that's available on a limited basis. I'm not sure what their qualifications are, so it's certainly worth reaching out if that's something you're interested in. Based on the geography, the area agencies on aging, I know there's one for Kalamazoo area, and then there's also kind of the southwest corner, and certainly as you move north. So again, it would be best to look that information up based on the location that you live in, and then you could reach out to the local area agency on aging. Another program that we have locally is Senior Care Partners. PACE is the acronym that they're using these days. So they provide medical and wellness services for senior citizens in Albion, Battle Creek, Kalamazoo, Portage, and kind of the surrounding areas. This is a program, again, that if it's something that you think you might be interested in, I would reach out to them. There are certain requirements for it, and really with Senior Care Partners PACE program, they kind of take over the full care of a patient. And so they would provide the primary care physician for participants. They'd be responsible for managing all of the care, the referrals, medication management. And for some folks, this is very desirable. And so, again, if you're interested, a great local program that you can reach out to and get more information on. So I think what I want to make clear is that there's a wide variety of services that are available when we talk about home care, and that it can certainly be customized to your individual needs. And so the best thing that you can do is contact your provider and discuss what your needs are, and then work with your provider to determine what care is best for you and your family. I did want to touch briefly on COVID-19, since the very reason that we're doing this talk in this format is because of COVID-19 and the impact that it's had on our lives. Currently in the state of Michigan, and certainly more locally in Kalamazoo County, Van Buren, and Calhoun counties, we're seeing quite the spread, and much more so than we did back when it first started back in March of this year. So it's very concerning. The community spread is quite high. The positivity rate, for those being tested, the positivity rate is greater than 10%, which is the highest we've ever been. During the summer, when we were looking at testing and positivity rates for our area, we were under 3%. So getting up above 10% is very concerning. And again, this is community spread. It's being shared in households and restaurants and venues out in the world. So we need to do what we can to really help slow the spread of this illness. And certainly as senior citizens, the risk is greater for significant complications. So we really need to be protective of ourselves and our family members. So I've just posted kind of the basic things, and it's not like this is new news. We've really been hearing this messaging for the past 9 months. So the big 3 things that you can do to slow the spread is to wear a mask. Again, it prevents, if you have the illness, it prevents you from spreading it to others. But recent research has showed it also prevents you catching the illness as well. Or if you do, that it's at a much lower level and so a lot less significant. So if I wear a mask and you wear a mask, we're really reducing the risk of transmission for both of us, which is fantastic. And of course, keeping distance, staying at least 6 feet away from others who don't live with you. And I know that there's been talk at different times about, so if I'm inside, I stay that distance, but if I'm outside and I'm wearing a mask, then I don't worry about the distance so much. Again, as a general rule, especially now that we're moving more and more indoors with our weather, it's really important to keep the distance from others and to keep a mask on when you're in the presence of others. And washing your hands with soap and water does a fantastic job of destroying the virus. So it's important to really pay attention to a lot of hand hygiene, more than we probably would use in normal times. So again, having frequent hand washing when you have soap and water available for you, and if you don't, using hand sanitizer. Both are really great effective ways to kill the virus that's on your hands. And of course, if it's on your hands and you go to your nose and mouth, that's a way to transmit the virus. So we really want to avoid contaminating ourselves. Certainly the symptoms to watch for, again, I would hope that folks are familiar with these, but fever, cough, headaches, fatigue, muscle or body aches. The loss of taste or smell is very unique to COVID-19, so if you experience that, that would be a real clue to get yourself in for a test. You can work with your provider to do that, or you can connect with bronsonhealth.com. We have some great tools out on the website. And of course, sore throat, nausea, diarrhea. The fever, cough, and shortness of breath are are present in 95% of the cases. So, and that comes from the physician clinical experts at Bronson, that they've looked at the research on it. So if you have fever, cough, shortness of breath, those are telltale signs. And again, work with your provider to get a test completed. I think the other piece, I can talk more about COVID, but I think the other piece I want to remind people about is if you haven't gotten your flu shot yet, please get that, because one of the things you want to make sure that you're able to do is only battle one illness at a time. So if you get a flu shot, then you can kind of take flu off of the plate of illnesses to deal with, and then you can work on focusing on reducing your risk of getting COVID-19. We certainly don't want to see anyone having to battle influenza and COVID-19 at the same time. So that's really what I've got for the presentation. I would love to hear questions and have any conversation. So I'll turn it back over to Julie.
Super. Just a reminder for the Q&A portion, I have questions that have been submitted via chat, and many of you can see some of those questions because some people submitted to everyone. So I'll cover all of those. And then if we have time, we'll also unmute the microphones for more questions. Let's start with, I have heard that even though your insurance covers stays in rehab facility, that there's a lot of pushback for that benefit. Who helps you obtain the benefit that you've paid for?
So the question is that they're getting pushback on how long they can stay in a skilled nursing facility?
It sounds like it. Let me read it again. I have heard that even though your insurance covers stays in a rehab facility, that there's a lot of pushback for that benefit. Who helps you obtain the benefit that you've paid for?
So my expertise is a little more on the home health side, but I'll try to touch a little bit on this, and then would also encourage you to reach out to your provider if you need someone who can help manage that a little bit better. So I know with skilled nursing facilities or rehab facilities, yes, insurance companies will pay for a certain amount of time in those facilities. That being said, I believe that it's an amount of time for a calendar year or some period of time. So I think there's some protection in terms of wanting to be careful about not using all of it at one time. And I think the other piece that people are very cognizant of is just the cost of care. So yes, that benefit is eligible for people, but I think really healthcare teams are really trying to determine what is the most effective and appropriate facility or setting for care. So for instance, let's say you qualify for care in a nursing home for 30 days and you're there and you're doing well in a recovery period, and at 2 weeks they start encouraging you to consider transitioning home. I think a piece of that is that the cost of the care in that skilled nursing facility from your insurance company is very expensive, and if you can have comparable, appropriate care in a setting such as home with home health or in an outpatient rehab setting, that it is more sensible to spend our limited resources in a manner that meets the needs that you have, but also is financially responsible. Again, if you have a particular situation, I would talk to your provider. If you have a Bronson provider, there's ambulatory care managers who are involved, and they're very good at being able to work with you to determine, what are the best needs that you have. And certainly if it's somebody who's already in a facility, I would be working with the medical social worker and the case managers in that facility.
Super. Thanks, Hilary. Here's one related to hospice care. Do you have to have a particular diagnosis of 6 months to a year to even receive hospice care?
So again, I am not a hospice nurse, so it's not going to be my area of expertise, but I know a little bit about it. So yes, there are specific requirements for a diagnosis that would qualify you for hospice. Whether or not somebody thinks that it's, a life expectancy of 6 months or 12 months, I don't believe that plays into it at all. It is the type of illness. And then also with the understanding that you are not going to be aggressively treating whatever that illness is. So, for instance, let's say you receive a cancer diagnosis and choose not to have aggressive treatment for that cancer. That would qualify you for hospice care. Now, it may be that you're surviving for another year. That's not going to prevent you from getting hospice care, but the distinction would be that you're not going for aggressive treatment for the cancer, that what you're looking to do is to manage the symptoms and to make the most of the time, whatever time that is, that you have left. And again, the hospice folks are fantastic and know this in and out, and they'll be very clear. And nobody's selling hospice, okay? Like if you qualify or a family member qualifies, they're doing that because that is a wonderful service that we have. But no one's going to oversell hospice if it's something that you're not interested in. So I don't want people to be shy about reaching out to local hospice providers, because they are the experts in this and can really help guide appropriate care. And again, if hospice isn't appropriate, they can help guide to maybe a palliative care team, either through hospice or through a home care or through a hospital setting. That might be another option.
And I'm certainly not the expert either, but on a personal note, I have heard a lot of people, they'll talk about that you have to have a certain diagnosis, like cancer, for instance, because that's what their knowledge is of other people who've had hospice. It's only for cancer, and it is not. And also the how soon you might get hospice, your provider may suggest it, and or if they don't suggest it, it's certainly something to talk about, because there's so many services through hospice that can relieve the tension on families. And so just look into it, get some answers, and it's changed and it's very open. And like Hilary said, the hospice folks are very knowledgeable and willing to share, and it's not a selling technique. Another question, back to home health, who is eligible for home health services?
So that's a good question. So eligibility for home health services really is determined by who the payer is. And so with Medicare, I'm going to say that that's probably the one that's most relevant for our discussion. With Medicare, in order to qualify for home health care, it has to be determined that the services that are being requested are appropriate given the diagnosis, and then also that the person receiving the services is unable to leave the home in order to receive those services elsewhere. So for instance, for a senior citizen who maybe gets out once a week to go to the grocery store, but otherwise stays home because they have limited mobility and get very short of breath with much activity. Based on that, they would be considered homebound and would qualify for home care services. Depending on what the diagnosis is, so for instance, if your diagnosis is congestive heart failure, then it would be appropriate to have a nurse seeing that patient in order to help kind of manage the symptoms and the medications. And it might also be appropriate to have PT and OT in there to help with exercises or other physical techniques that would improve that patient's ability to get about and have a little better quality of life. Most of the time with home health services with Medicare, they're ordered for kind of a 60-day period time. That doesn't mean that everybody will have 60 days of care. It's just the way that Medicare kind of structures payments to home health agencies. When I look at the national data for home care, the average length of stay with home care is about 45 days. And again, teams come in, the nurses, the therapists, and kind of determine, you know, working with the senior citizen, what is the goal, and then what can we do to kind of get to that goal. And most of the time, folks meet that at around 45 days.
Great, thank you. What specific measures are in-home care services taking to prevent the spread of COVID-19?
That's a very good question. So I cannot speak to what all agencies out there are doing, but I can let you know what we're doing at Bronson at Home. And being part of the larger Bronson system, we're very fortunate in that we have kind of the ability to share great knowledge and resources across the system. So first off, I'm just going to say how appreciative I am to be part of that system. So all Bronson employees, including Bronson at Home employees, do a health screening every day before reporting to work. And based on the answers to questions that are given, if they have symptoms of anything, then their leaders are notified, and then the determination is made as to what next steps are in terms of actually interacting with patients and or coworkers. In addition, Bronson at Home, every time we do a patient visit, we are calling ahead of time, and we are screening patients and family members for illness in the homes. And that way we can kind of work with our patients to better understand what we need to do to protect both of us, but also whether or not it's appropriate for a home care visit on that day, or if there's some other medical intervention that needs to occur. When our staff do go in, they wear medical grade masks and face shields with patients, and that's standard across all patients. So whether you have symptoms of anything or not, our clinicians are going to be wearing mask and face shield every time they interact with folks in the home. And then certainly if anyone has had COVID or has been a family member has had COVID, then we follow the hospital and CDC guidelines requiring the personal protective gear that we wear, so that would be a little more involved. And again, that's on a very individual basis. We kind of, you know, need to watch when any sort of infection occurred, and then determine the PPE that's needed for that interaction.
Super. Along the line of COVID, do recovering COVID patients need to test negative again before going out in the community?
So the answer is no. I will, now I'm going to qualify that only to say I know that to go out into the community, no, but I know that if you have someone who they're trying to place in a nursing home, a lot of the nursing homes have qualifications about testing negative before they will accept patients in. We're very fortunate to have Dr. Van Ink, who's an epidemiologist at Bronson, and he's done a great job of sharing all his knowledge with us. So the research has shown that with COVID-19, those recovering from COVID-19, that if you've had a mild illness, that at the 10-day mark, there's no need to have the kind of precautions that we typically take with COVID patients. So as health departments are kind of recommending to folks that you should be in a 14-day quarantine, but after that, then you, assuming that you are have improving symptoms and you've been without a fever for at least 24 hours. And the fever being without fever, without medication. So no fair having a fever and taking Tylenol to bring it down to kind of qualify to get yourself back out again. But again, for a mild illness, 14 days of keeping to yourself, and you should be good to move back into the community as long as you're not having fever and your symptoms are improving.
Great. We have a compliment out here. A friend of one of our participants just received a medical alert system through Pride Care Ambulance as recent as yesterday. It has a range of 1,000 feet, and it gives her the peace of, she or he, the peace of mind that miles away, because she's, let me read it as they said it. I was trying to interpret.
Yeah.
A friend just received medical alert through Pride Care Ambulance yesterday, range 1,000 feet. Gives me peace of mind miles away because I am the patient advocate. It's a great service.
Yeah. Yeah. So a lot of, there's a lot of companies out there that provide this service. Bronson at Home provides this service as well. So I just know from being on this side of it that it is a great service, because we can have that push of a button. You get to the ambulance service, and then they can either call a family member or a friend to come check on you if it's not a critical moment, or they will deploy EMS to come out and help you. So it's a wonderful, wonderful service wherever you get it.
Thank you. And I have a couple of their comments related to, this has been a great presentation. I appreciate the information. I want to remind people to put in some questions via the chat box, but I've exhausted the ones that have been submitted so far. So what I'm going to do is open up the mics, because there may be someone who would rather ask verbally rather than talk in the chat box. So I'm going to unmute, I think I did it, unmute the microphones, and we have a few minutes. So if you have a question, you can chime in. You can if I do this right.
Sandy has a question.
Go ahead, Sandy.
Did I understand you to say that quarantine could be 10 days for some people and maybe 14 days for others?
So the research that has come out has suggested that with a mild illness, that the infectiousness of the disease is pretty much over at day 10. And so in our hospital system, we no longer worry about the protective equipment at day 10 for patients who have had a mild illness. Now, what the CDC, and that's following what the CDC has outlined in terms of the protective equipment. What the health departments are telling people is 14 days of quarantine or isolation. So I don't want to tell you not to go with what the local health department is saying. So if you're at day 12, let's say post-COVID, it's probably best to wait till day 14, because that's what the health department recommended. What the literature has shown is that for someone experiencing a mild version of the illness, it's about 10 days. And again, with no fever and improving symptoms. So is that clear enough?
Yes, thank you. Thank you, it did.
I have a question.
Yes, Dorothy?
You mentioned about the Area Agency on Aging. Could you tell us how we would find that number in order to contact them? I live in Portage.
So if you go to Google and put Area Agency on Aging Portage,
okay,
it will pull up the one that is appropriate for Portage.
Thank you.
I was hesitant about putting too much information in there because it is kind of a weird geographic map. So
thank you.
Hi, this is Lisa from Disability Network. I can share for Kalamazoo County, the Area Agency on Aging 3A. Their information phone number is 373-5173.
Great, thank you, Lisa.
You're welcome.
And perhaps, can you repeat the phone number again, just in case someone didn't have a pen right away?
373-5173.
Super. Thank you. And I just got a message on my computer that I've given the capability back for you to unmute yourself, but I can't physically unmute you. So if you want to ask a question, unmute yourself and ask away.
I have a question, Julie.
Please go ahead.
Thank you. Ma'am, I would like your definition of a mild case of COVID. What are the specifics for determining the number of days to isolate when the general term is mild?
So that's a good question because, that's probably open for a little interpretation. I think from the perspective of the hospital, how we're looking at it is if a mild case would be one where you were not in the hospital, you do not require O2, that you basically had the illness and remained at home during the duration of the illness. Again, I want to be cautious about whether you're kind of keeping yourself quarantined for 10 days or 14 days, or I think the key piece is to make sure that we're keeping everybody safe. So the local health department is advising folks to remain quarantined for 14 days. In terms of the requirements for the personal protective equipment for healthcare workers interacting with someone recovering from COVID, at 10 days, we can take them out of those types of precautions and just interact as we normally would with a face mask and face shield.
Thank you.
And, if ever in doubt, talk to your provider, your primary care provider. They, again, specific to what your health is and what your risks are, and making sure that you're making the best decision for yourself. Work with your healthcare provider for that information.
Yeah, I'm just wondering in terms of the general population, and since there's a bit of gray area, my personal opinion is to err on the side of caution.
Oh, absolutely. Yeah. Well, and I think
a couple more days.
Yeah. Well, really, what's a couple more days after 8 months of all of this? Yeah. Well, and again, I think a piece that we didn't even talk about is the folks who may have COVID who don't even have symptoms or have such mild symptoms that they're not even thinking COVID. So, there's a huge risk, I think, with that, or running into people before they become symptomatic. Again, why it's so important
Come on in, Jeremy.
To have masks and to really have great hand hygiene and really keep the distance as much as possible. I tell you, I work in an office space, and our intake staff and some of the nursing supervisors, we're in this building together. And what we have done is really try to space everybody out and apart. And when we're together, if we're in a hallway, if we're in our offices and talking to each other, we both have masks on. And we're wiping down surfaces and we're doing hand hygiene. So, we're doing whatever we can to reduce the risk in our area, and I would encourage others to do the same. I think all of us feel like, first off, none of us want to get it. And secondly, none of us want to be the one who brings it in either. So do what you can to, help yourself and help others in the community, and wear the mask, wash your hands, keep some distance.
Thank you. I really appreciate your help.
Mm-hmm.
I have a question in case anyone can hear me.
Yes, please go ahead.
Basically, I'm intrigued by the expanded definition of hospice. So could someone be in hospice for a couple of years if, for example, that person had a lot of autoimmune diseases, chronic fatigue, homebound, but was never, ever going to treat anything aggressively, could that person be in hospice for 2 or 3 years as long as they weren't going to try to do anything about their autoimmune situation?
So again, I am not the hospice expert, and I would say have a conversation with one of our local hospice providers. But I personally am aware of a couple of people who have had hospice services for well over a year, and probably very much for the type of situations you're talking about where they have some life-limiting illness, but it is not imminent. But they're also not choosing aggressive interventions, and so they qualify then for those services.
Yeah, or there may be none. For example, fibromyalgia, chronic fatigue, polymyalgia, rheumatica. I mean, there's only so much you can do, and then you're just stuck.
Right.
Yeah. Okay.
Yeah, and truly, as Julie and I both said, the hospice nurses who do the intake process are so knowledgeable, and they can very clearly tell you what would qualify or not. And again, the time frame is not the determining piece. It is about what the illness is.
That's wonderful. That's news to me. I had always thought the time frame was. So thank you so much. That's great. Okay.
And I appreciate these questions about hospice because being the program coordinator at Portage Senior Center, I always have my ear open for new ideas or different programs that or topics that people are interested in. So I've just made a note to myself to research a future speaker about hospice. And so stay tuned. It probably won't be till the first of the year, but stay tuned. That might be a subject that we will offer for getting more details.
Terrific.
And any other topic that it doesn't even have to be health related, but if anyone has a desire to hear a topic, let me know. We may or may not be able to pull it off, but we're going to try. That's what we want to know is what are the interests out there that we can try to cover for people, especially in this virtual world right now.
Julie?
Yes, go ahead.
I just have a question. Maybe you have already covered it as a topic for Portage Senior Center, but has the durable power of healthcare been addressed as something that if people do not have it in place, there's really a benefit for doing so?
We have, back in the day when we had some in-person meetings, we did cover it, but that's one of those subjects that can be covered often. I don't know about often, but maybe yearly, that kind of thing. And I'm glad you mentioned it. That's one that we can see how we can work it out to have it be a virtual program. So thank you. At this point, let me point out that Hilary's contact information is on the screen. So please take note of that. Having her put it on the screen, that means that she's giving you permission to call. And so if you have questions after this program, please call. And my information, especially if you have questions related to the Portage Senior Center, future programs, etc. Again, my name is, because it shows up on your screen, it's Portage Senior Center. My name is Julie Vandernoot, and my phone number is 269-329-4553. Again, that's 269-329-4553. And my email address is vanderNJ@portagemi.gov. That's vanderNJ, VANDERNJ @portagemi.gov. And it's just 10:30. Hillary, do you have 2 more minutes to stay on just in case we have another call? Or question. All right, everyone. This is your last chance to either type in a question or ask it verbally.
If you think of anything after the fact, feel free to reach out and I'll share what information I can.
Super. Well, thank you everyone for attending. I think this has been a robust session. I really want to thank Hillary. Very, very important informative, information shared today. And again, everyone reach out to either Hilary or me if you do have questions or concerns. And stay tuned for what other programs both Bronson and the Portage Senior Center will be offering. Thank you, everyone.
Thank you.